Hello, hello, hello. I'm so excited. I know I'm always excited, but this I'm really excited about because this lady rocks, okay? The last time she came on, I just had such a buzz. I couldn't sleep that night. We had such a laugh. So I am hoping that you guys are going to enjoy tonight because we're going to take a very light-hearted but kind of real in-depth look into where does physiotherapy fit with managing OA. Now, one of the good things about me is I'm a convert, okay? So I started my life as a vet and I've slowly drifted over kind of learning about all of these other interventions that work for managing osteoarthritis. So I kind of get really excited about this. So sorry, I'll calm myself back down. Heli, tell us about you.
Oh, that was a hard one for the first question. Okay, so my name is Heli. Forget the last name, that's absolutely fine. I'm a physiotherapist and I come from Finland. I work at the University of Helsinki and I also teach at the University of Liverpool. And my topic is the veterinary physiotherapy and anything related to it.
She knows a lot. This is going to be so good. And I'm doing a rehab diploma, so I'm really excited about picking her brains too. So we're all going to learn together. Now, we got so much to talk about. We were like, where do we start? And what we decided, well, we're giggling before we went live, is that you're going to just give us an overview of what physiotherapy is. And then we're going to use 3 case examples. We're going to start with the young dog with early OA. Then we're going to do a dog that seems to be plateaued in the middle part of its life. And then we're going to look at a really, really debilitated dog. And the reason that I wanted to do this is because I, in my career, have heard people say to me, oh, it wouldn't work now. You know, he's too young. It's not bad enough. Or I've also had people say to me, it's not going to be of any benefit. He's too far gone. So I wanted to get both ends of the spectrum. So tell us about physiotherapy. What is it?
What is it? Well, it's like the coolest profession in the world to begin with. Obviously. No, but it is actually. And when we talk about dogs or any animal or humans, but anyways, in this case, dogs with OA, that being osteoarthritis, physiotherapy is a really important part of management of osteoarthritis. It's obviously really important to realize that we can't heal it, we can't make it disappear, we can't fix it as such. It is there. Usually if it does something, it probably gets worse. But what we are there to do is to manage the signs and symptoms of the disease. Mm-hmm. And physiotherapy has to do with movement and functionality. So we are there whenever there is issue in movement, disorder in movement, and that usually then leads into movement dysfunction, leads into dysfunction, which means that the dog has issues in its daily functions. Even like you said, we're going to talk about the dog who's had OA for a very long time and is having a lot of problems. Those problems usually are can't walk that long, can't run anymore, can't jump somewhere, cannot walk the stairs, or is having trouble going out for pee and poo and all that sort of thing. Yeah. So physiotherapist is there to try to help the owner to manage the signs and the symptoms of the disease and help to keep the animal as functional for as long as we can.
Yeah, so and then I'm going to butt in there. Just let me just do something because this makes so much sense, guys, right? So we want our dogs to be happy. That is it, isn't it? As an owner, you want your dog to be happy. And just taking away the pain might not be all of it's about. It's about giving them their independence back. You know, when I had the absolute beautiful Holly, I just knew that when she was really not coping, her life, her world got smaller and she was less happy with life. So we know that their independent mobility is really, really important for their happiness. And if they're happy, we're happy. So that's why let's keep plugging on about independent mobility, function. Carry on.
Thank you. And that is actually very, very true. It's a really important part of I'll put it the other way around. The dog's welfare is a really important part of the owner's welfare too. And walk hand in hand both ways. So anyways, if we think about dogs with OA, obviously, most commonly, the two main problems are the pain and then the issues with movement and mobility. And those are the two main things why we would have physiotherapists involved. Yeah. Now, really important thing is what I like to tell to everybody is the physiotherapy process. I know it sounds a bit boring, but it really is really, really cool. So often in the olden days, long time ago, it might have been a case that people, let's say you injured your shoulder, you went to the physiotherapist and they would give you A4 paper saying, there's exercise for a shoulder patient, go home, sort of a thing. And you would kind of get the same paper. If you had an issue in the shoulder, it didn't matter if it was ligament injury or muscle tear or dislocation, shoulder exercise, go home, sort of a thing. Yeah. We haven't done that for the past 15 years at least.
Well done.
There is a thing called physiotherapy process. And that means that every patient goes through that process. And the process very shortly, well, not that shortly, but anyways, the process means that whenever we get a patient coming to physiotherapy, it is most commonly referred by a veterinarian. Yeah. And when the referral comes, it says, here is Blackie the dog. It has OA in the hips. I'm referring it to physiotherapist. This is what we get from the vet. I'll take in Blackie the dog to physiotherapy and I'll read the referral from the veterinarian and I go, aha, hip OA. But I've treated thousands of dogs with hip OA during my career. None of them has been the same. They all have the same diagnosis, but they all are different in their problems. Some of them are more painful, some of them are less painful, some of them can't extend their limb, whereas some of them can't flex it. Some of them sit absolutely perfect, but some of them just don't. So they are all very different, although they have the same diagnosis. So my physiotherapy process starts from me examining the patient. And the point of that examination is not to question the veterinarian's examination. No. It's a physiotherapy assessment of that patient when I'm trying to find out, okay, Blackie the dog, you have hip OA, but how does that affect you as an individual? So I'll try to find physiotherapeutic problems. Is it the extension of the hip or the flexion, or can't he wee with that leg up or down, Could be something functional in its normal daily life, something that the owner has noticed, or it could be something that I find out in my assessment. We measure a lot of things and we do lots of different things to assess the dog. So we first assess the patient. Then we find out, based on that assessment, what are the problems of this dog. Then we discuss with the veterinarian who refers the dog and with the owner and whoever is the caretaker of the dog. And then we agree, what are the aims for the physiotherapy? What do we need? What are the problems? If one of the main problems usually is pain, that's the first problem. And we need to get rid of the pain. So that would be the aim. My problem is pain. My aim is to get rid of it. Quite simple, actually. So everybody can But we list the problems and then we list the aims. And obviously the aims have to be agreed with the whole team. So this is why multi-professional team around the dog is really, really important. Because we all pitch into what is achievable, what is realistic, what needs to be done. Everybody has an opinion. Yeah. Then when we've assessed the dog, we've found the problems, we've set the aims, then we start thinking what therapy methods we should use to get into those aims.
Yeah.
So we don't have any sort of recipes for all the OA patients. You know, all the hip patients have the same therapy
and that's
method.
a really good point for me to just interject a bit, because it is quite frustrating that online you can go on some sites and they really feel that they can give you a protocol, a paper protocol. And so you could go to a site and your dog's had a TPLO surgery. So it's a cruciate problem. It's had a TPLO surgery, and they give you just a black and white list of what you do when exercise-wise. And part of you goes, I wish that was so true. I just wish it worked like that.
Wouldn't it be lovely?
Lovely. Yeah. But the truth is, it doesn't, because that dog with that TPLO surgery, the surgery could have been very successful. It could have been marginally successful. It could have secondary pain. It could have other complications. So you're actually giving them a black and white plan and going, that's it. It's potentially dangerous. So what you're saying is that the dog has to be looked at as a unique individual case, and the plan tailored around the dog.
Yeah, because there are so many different factors affecting the hip OA in this case. They'll never be the same. Their environment isn't the same, you know, so many different factors. So definitely it all has to be very, very individual.
Okay.
And so the next thing is we've now had our aims. We've selected the therapy methods that we are going to use, and within each method, how we use them and for how long, and how we combine them to other methods. So it's quite a big process, actually, deciding what is exactly like you said. First of all, everything has to be safe, and then it also has to be efficient. Otherwise, it's not fair to the owner nor to the dog. And then we start actually realizing the therapy, and we actually do the therapy with actual all the time repeated outcome measuring. So we all the time measure, is the therapy safe? Is it efficient? Are we getting to the results that we need? Is the rehabilitation progressing as it should be? If not, we'll immediately contact the veterinarian, who is the referring veterinarian. So the team is working all the time, and the communication between the vet and the physio is really, really important. It never works alone. It's always the communication, and the owner is involved, obviously.
And that's where
how the process goes. And we change, obviously, because we assess every time again. They'll never progress like you planned. You know, you'll make a lovely plan every time. Every time we make a plan, give it to the owner. And whenever I reassess and realize, oh no, it's getting better faster than I thought. My exercises are way too easy. I need to up my game faster than I planned. So it's a plastic process. We'll change it all the time.
Yeah.
And that's how it moves.
You just said a little back about communication. And I just want to up the CAM team. We've been working on creating a new owner handout for you guys to try and make this whole process of getting a referral for physio or for hydro safer, more comprehensive. So there's going to be a PDF coming out soon that the lovely Emma and Robin and the new person on the team, Alison, have been working on, and Mel Bruder, who wrote it originally, to make sure that you know who you're picking, what qualifications they have, how they work, whether they work with their vet, are they insured, all these things that you should tick to make sure you're going to somebody that's got wisdom, experience, they've got safety and efficacy as their main priorities, you know. So that's going to be out soon. So well done, CAM team, you're awesome.
Yes.
Let's now talk about the huge toolkit you guys have. Like, this is just, it's such a dream. If anybody is a kind of like a technical geek, there's so many toys. Whether you use all of them, I know we were just talking earlier that you can't beat these little beauties. They are a be all and end all of everything, but there is a lot of other tools. So what sort of things do you guys incorporate into your physiotherapy protocols?
This is really true. We have lots of cool kits. So, something that I actually want to say about all the different therapy methods, there are a lot of them. there are lots of actual therapy methods that physiotherapists use, and they are part of our toolkit. And then there are lots of things that often are sorry, I'm missing a word. Give me a second or two. They are kind of put together. They are kind of assumed to be physiotherapy methods because they kind of resemble our electrotherapy methods, for example. But actually, they are not something that an actual physiotherapist would use. Ooh, so okay. there are lots of different equipment available to everybody, you know, around the world these days. But it's really important to know that when we use different, let's say, electrotherapy modalities, like different electrical treatment thingies that are available, not all of them are, first of all, even necessarily safe or efficient. So physiotherapy always aims to be evidence-based, which means that whenever we use any sort of therapy method or even assessment method, we want it to be safe, efficient, appropriate for the use that I'm using it for. So we want there to be research, actual scientific research behind it, and it has to be good enough quality research, and there needs to be sufficient amount of it before we can actually say that, yes, I know that it's safe, yes, I know that it's sufficient, and yes, therefore it's okay for me to use it. So not every equipment that is available is like that. Now, important thing also to know is not everything is researched yet, sadly, which is good to me because I also do research, so I still have jobs to do. But we do have, let's say that not all electrotherapy equipment that we use in physiotherapy are necessarily researched directly to dogs with OA, but we know that it's been researched with humans with OA or humans with other diseases or some other species, horses, for example, and it's been used clinically. So also the clinical experience is an important part of why we would use stuff.
I think I would...
Oh, sorry.
No, I think I would just add to that. Just a really kind of like Hannah, the mother online, trying to look after all of the followers, because that's what we see ourselves as, Cam. We try and look after you. You know, we don't want to force you to do anything, and we're not dictating that you do anything. We're trying to walk back. That's what we're trying to do. And something that is really, really logical to me now, but might not be so much to you, is having an appointment with a physiotherapist doesn't bind you into having to have them every week forevermore. They are your gatekeeper to what other things you can add to your dog's management plan. So yes, we'd like you to see a physio and build up a rapport with them and see them on a frequent basis. But if you can't afford to do that, or you don't have that accessibility, you can still use a physio and say, well, look, I've seen this online. What do you think? And they'll be able to say, or yeah, actually, you know, that's not bad, and where I would use it on your dog, and this frequency of use, and these are the signs that you don't want to use it, and why don't we check in again in 4 to 6 weeks and see how you've got on. And I think what people really get scared at, be it with a physio or with a vet, is that commitment long term and the financial implications. And it's like, you know, chronic disease is hard work. So just do me a favor, before you hop onto Amazon or to eBay and you suddenly decide to go and buy the first electrotherapy device that says it's singing or dancing and it does canine OA, which, by the way, I would run a frigging mile from if they're really saying on their label, we treat canine OA, I'd be like, no. If they've got any integrity, they don't do that. So if you're finding something online, stop. Think about it and maybe get some professional advice before purchase. To see a physiotherapist in the UK, it's around about anywhere between about 45 and 65. Correct me if I'm wrong, guys. If there's any physios here that think I'm really out of the ballpark figure, do shout. But realistically, the amount of advice that you get for such a low fee, considering what they're going to give you, it makes sense. Yeah.
And also, yeah, very good point. And I'd like to add that really people often ask, how many times do we need to come? Again, I don't know. No one knows until you've gone through the physiotherapy process, until the dog has been assessed, until we know what problems it even have. Some dogs don't have, they might have hip OA, but the problems are so mild. I'll give you home exercises. I'll give you instructions. We'll see today, and then we'll see again in 6 months' time. You might not need anything more than one time of getting instructions, whereas some dogs might need 15 times in a row within 2 weeks. Well, that's a bit harsh.
That's a bit harsh.
Within 1 month, like twice a week, 1 month, and then again, whenever it gets worse. So it's very individual too. So don't decide not to go in a fear of it might become expensive, because it actually might not. Just please do that one assessment, because also we are humans too. I mean, it may come as a surprise because we do seem like superheroes. I know, but we actually are humans, and we also have dogs, and we just don't get paid that much. So we do understand. No. Yeah, exactly.
Seriously, okay, I'm going to just do a little bit of fend for my own kind today. For a physiotherapy assessment, a lot of these guys are mobile. Some of them are connected to practices. Some of them are mobile. Some have to actually support their own facilities. So they might have their own building, the cost of the overheads of the building. When you actually look at how much they come out with at the end of the day, it's absolutely demoralizing. So if you are a physiotherapist and you're charging, let's say, a ballpark figure of £50 a session, which some of them are less, some of them a bit more, and you're doing maybe one of those every hour to hour and a half, but then maybe you've got some traveling in between as well, and you haven't got a full day, so you're not going to do 10 hours back to back. It's not a big take-home wage when you've got all the overheads. You've also got to remember these guys are writing reports, so they've spent an hour with you. They're going to spend another half hour writing your report and disseminating it back to the practice, getting ready for this person. I just really feel that it's an opportunity to say that these people, hydrotherapists, physiotherapists, vets, they work very hard. And when you actually look at the take home, it's really sad. Hydrotherapists especially, because they have big overheads running those facilities. So just bear that in mind. Next thing I just wanted to add. Oh, no, you go.
No, sorry. No, I just wanted to say that for this reason, we understand, for example, if, you might live far away, you can't come every week. Fine. We'll fix the physio according to that.
Yeah.
We understand if you run out of money after having 3 surgeries done within 6 months, you just don't have money anymore. We understand. We can still fix it, because that's the whole idea of process, and setting the aims is taking also into consideration what can the owner do, what are the facilities that we can use and so forth. So yes, we can work around the how many times can you come for whatever reason and so forth. Yeah. But can I answer your previous question though?
Yes, say it.
I have to tell you, I once got feedback after a lecture, too interested about her own topic, and now this is where I remember that feedback. But I'm getting back to the original question: what therapy methods might we use with OA patients? That was the one. So the ones that I was thinking about this beforehand, and I kind of came up with the ones that I most commonly use with dogs with OA would be, like you said, the manual.
Yeah.
So it can be soft tissue mobilization, massage, stretching, and joint mobilization, which is either to increase the joint range of motion, but it can also be used only to control pain. So do very small mobilizations. They're not just flexing and extending, you know, bending the joint, but we do very specific movement combinations. So those are the ones I use quite a lot. So-called thermal treatments, which is your superficial heat pack and cold pack. My favorite cold pack would be frozen peas. Do not, I repeat, do not eat them if you have frozen and defrozen them more than once. So if you defroze them twice or 3 times, mark the package, don't eat it.
Don't eat them.
You know why? Yeah.
Okay.
I once got a very angry feedback from an owner whom I didn't tell this to because I assumed it's obvious. It wasn't. He ate them. Problems followed. So don't eat them. Okay.
Well, there you go. How to avoid diarrhea after a physio.
Yes. So
you got manual therapies, and then you also told me earlier that you really like to impart knowledge and education about how owners can do manual therapies as well. Yep. And also, as you say, with the heat and the cold packs, again, owners can continue to do that. Amazing.
Yeah. So I most commonly teach my OA dog owners to massage their own dogs, so they can they have a tool to manage the dog's signs and symptoms of the disease. And then they come to physio and I'll go through the dog and palpate through, and then I'll tell the owner that at the moment this and this part feel tight, maybe concentrate on them. And then, you know, they'll always get further instructions. If they are willing and able to massage the dog, they can do it. Stretch the dog, same thing. It's a tool for the owner, but it's up to me to choose how it's being done and then teach the owner. Ensure that they'll do it appropriately. Same with, like you said, cold pack, heat pack are just tools for the owner to use on the dog. So they don't come to you and me put a cold pack on them and then wait and, you know, the bills keep piling up, sort of a thing. But it's something we use at home.
Yeah.
Then
and the other major one, which was really, really not expensive, therapeutic exercise.
Yes, and that's my favorite. Therapeutic exercises are, because they are really, really efficient. You can use them for pain management, but obviously then, you know, strengthening the muscles in case of atrophy or weakness in the muscles. You can gain joint range of motion. You can affect the functional issues. So definitely we have so much knowledge about if the dog walks uphill or down the stairs or up the stairs or over the poles, or what happens in each joint, how much they flex in relation to each other, you know, how the muscles activate. They've been measured with EMGs. You know, we know how each muscle reacts in different actions, and it's really, really cool, and it's really, really important. So the active therapeutic exercises, again, it's something that we as physios select for that patient, the appropriate exercises, but the owners are the ones who are given them as a tool to exercise the dog and to help the dog with its problem.
Because let's be honest, a lot of these interventions are only going to be effective if they're done on a frequent basis.
Yeah, so exactly like humans exercising, you know.
So hopefully in a few weeks, I'm actually going to invite my PT. So he's a rehab PT. He's going to come and talk to us about, you know, looking at it from a human perspective, because he's given me a load of exercises and I have to do them daily, if not twice a day, for them to be beneficial. Otherwise, I'll go back to see him and nothing will change. Yeah. So
you immediately see that you haven't done your exercises. That's all bad.
I know. So something that I just wanted to say, because I felt it really helped me understand when I was starting to learn. When you see a therapist, and it might be a physiotherapist, a hydrotherapist, a massage therapist, anybody that's doing a kind of observation or a palpation, when you're seeing a dog, it's like peeling an onion, because you lift one layer of chronic change. And that might be pain here, that might be tightness, restriction, fascial adhesions. And then there's another layer. So as the weeks go on, it's almost like lifting a layer, lifting a layer, lifting a layer until you get the beautiful bulb, you know. But it is true, the picture changes. So again, when you read online where someone's just taken a little bit of advice from a black and white platform and they're doing the same thing, the same thing, the same thing, the same thing, just be a little bit concerned, because if physiotherapy is working, it should be changing as the disease state changes. Yeah?
Yeah.
Okay, so I think we've done pretty well. We could go into all the tools, but I think we decided it was better to bring context to what to use, when to use it.
Tense.
Oh yeah. Go on then.
One of my personal favorite tools, one last one, and then we'll go to the cases, is TENS. TENS. Transcutaneous electrical neural stimulation.
Yeah.
Cheap and cheerful, I think, is the word you guys might use in English. So it's not an expensive tool. It's about a mobile phone size unit, treatment unit, and you have wires coming out and rubber electrodes, little rubber flaps. Is that a word?
Yeah. Flaps.
Which are then put on the dog, on the surface of the dog, and whatever settings your physiotherapist has chosen is then what the machine sends out, and the electrodes then move the electricity into the dog, and you can actually stimulate the new nerves of the dog with that electricity, which then can manage the pain. And with some patients, I have found it to be very useful.
Yeah, and my dad pretty much wears one the whole time. Yeah. So it's tucked in his top pocket, and the little wires are going to his lower back where he's got the pads stuck to his skin. Just for people that don't understand, so transcutaneous electrical neurostimulation is basically trying to confuse the brain in many ways, in that our brains we only perceive a certain amount of pain, and if we can trick the brain and make it be aware of other things that are going on, we can potentially kind of block the pain signals. That's one very, very broad overview way of it working. It's obviously a lot more complicated, but it's all to do with like the pain gate theory and stuff. And we were just talking about me using it today on my sister's dog, and I was just like blown away at how effective it was on her. But some cases it doesn't work. We have to be honest, don't we? Some cases, with the best intention, you introduce the therapy, you have high hopes that it's going to reduce the pain, allow you to do something else potentially after it, but it doesn't quite hit the mark to what you want it to do, does it?
No. Yeah. No. And this is why, again, I'm back to physiotherapy process and reassessment. So if something doesn't work, because there's no treatment that would work every time on everybody. So obviously you then reassess, and then from our huge toolbox, we'll find something else. And the word is pad and not flap, obviously. But if that's the only language barrier thing tonight, I'm happy.
No, you did really well. I was going,
let's move on.
What do you mean?
I don't know where it came from.
So we've done your major loves, which is hands-on therapies, hot packs, transcutaneous electrical neurostimulation, and therapeutic exercise. Now, let's be honest, guys, they're not expensive, and they're things that all of you can continue to do after your physio appointment. So this is what's really exciting about this. We know that a lot of people on low budget, a lot of people have their very precious funds dispensed elsewhere. It might be on medications, it might be on surgeries, it might be on the other dog, it might be your situation has changed. And what with the current, economic climate, we're going to be very aware that a lot of people are having to really think about where their money goes. So this is quite exciting for me that we're talking about something that's accessible to everybody. So now let's go on to our cases so you can start getting some context about how these things fit in. Let's start with case one. Case one is an 8-month-old golden retriever with dysplasia, and is presented with quite an abnormal gait. He's quite unruly. He's all over the show. He just loves everybody. Doesn't ever sit, doesn't do as it's told at all. He's just kind of got ants in his pants, okay? And you can see that he's a wiggle all the time. The owner's been to see the vet. The vet has diagnosed hip dysplasia, having done an examination, a sedation, and x-rays. It's quite significant hip dysplasia. So we've got a quite significant subluxation, and we've got the beginnings of some arthritic changes. So already at 8 months, we've got some sclerosed bone. We maybe even have a few little osteophytes forming. And we know that the dog is sore to touch around his hips. He just tries to get away. He does it really friendly. So, don't touch me. He really doesn't like his hips being extended at all. Does everything to avoid that. And he flops instead of sitting. He just goes from standing to flop lay. What are you thinking? What flows your mind?
How many hours do we have?
No. I know.
Let's start with, there is no reason why a dog with hip OA wouldn't be taught appropriate manners and behavior. And it could be, if he's all around and he's a bit ruly, and there's, because sometimes when you have young dogs who are poorly, you kind of go, oh, but he's poorly and I don't, and then they end up being monsters. So actually, I would recommend that let's start active therapeutic exercises from the point of view of it's a young dog. We have to consider many things. One of them is the behavior. Maybe let's start exercising things that at the same time are obedience, but also therapeutic exercises, sort of a thing. Yeah. So we're kind of killing 2 flies with 1 strike. Or that's what we say in Finnish, but
we say birds with 1 stone.
Birds with stones. Horrible. Absolutely horrible. So flies or birds. But that's something that springs to mind first, because to do things appropriately, it's pointless to do exercises if they are not being done correctly. So, we need some control over the dog. Anyway.
I think I've just put that in because we know that there is a behavioural component to pain. And I think there's a lot of owners out there that would assume that their dog's just being naughty when the dog has learnt that is a behaviour to have to get them out of doing things that are actually painful to do. And we also know that pain can affect learning. So if a dog dealing with pain, their ability to learn new things is going to be difficult. Their cognitive processing is affected. So I only include that to spark. Maybe somebody on here is listening going, that's my just for the spark.
And also, actually, it's really important, again, because I just brought this up because I think you can't just do physio. You have to think of, especially when it's a young one, you have to think about all the other things because it's a growing dog and the owner has to live with it for the rest of their life. But also, you should never do any therapy through pain. So then it's really important, exactly what you were saying. Some of the behavior may be actually pain behavior, but we should kind of somehow find out which is and which isn't, and at least play safe, because all the exercises need to be done high quality, no pain sort of an approach, which will then obviously help with the obedience training and all that. So it's kind of a big ball.
And this is where that multidisciplinary team may actually come in. And it might be wise, if you are the owner of that dog, to make sure that your trainer or your behaviorist is actually also talking to your physio, who's also talking to the vet. Having a conversation can be really important because, come on, guys, nothing worse than, say, a dog trainer going, well, your dog's just being really disobedient. He needs to learn to sit. And the dog's going, just do it. It's really
no.
So,
like this golden retriever just it literally is not because it's naughty, it just can't because of the hips probably.
Yeah.
But going back to physio, I would personally think on the lines of primary problem being the hips, possibly pain management wise, we could do some very, very gentle joint mobilization just to control the pain. Soft tissue work, especially really important with these animals, especially the young ones, because they are learning ways of moving. And obviously he or she is going to find a way how to move with less pain and less problems. And that might mean huge amount of compensations that we have to consider, which may lead into secondary problems because of the way it moves. So soft tissue, like let's say massage, sort of therapy is also to scan the dog to make sure that we are aware of what is happening in his musculoskeletal system throughout the dog, not just the hips, because we can't just stare at the hips and forget all the rest of the dog. So the secondary issues is one of the main things at this stage, I would say. But then the therapeutic exercises, provided that he's learning, she or he is learning them, from the obedience point of view, we can teach new tricks, which should be good fun also, and try to teach things like if it can't sit appropriately on the ground, maybe have it sit on a step that it's not such a big range that it has, there are lots of different things we can do. But I would go for manual mobilization, joint and soft tissue to manage pain, to allow range of motion as pain-free as possible. Therefore, it can do the functional exercises that I want it to do. And I will amend them according to on what level the dog is at any given time.
Yeah. And then I'm going to butt in.
One good sorry, I'll just think.
No, I was going to butt in because being the vet and part of your treatment triangle, I would be saying, well, if this dog is quite sore, let's work together. I'll put him on a non-steroidal.
Definitely.
Yeah, I'm trying to get
that's my assumption that it is on pain medication.
And then I would be waiting to hear from you whether I even need to add more. Because if he's really sore, you might say to me, actually, Hannah, do you know what? Crikey, we need to throw the book at this dog. Let's add in an adjunct for a period of time. Let's see what the response is.
Yeah.
And because of my obsession about the environment, now I'm going into occupational therapist mode. I would be really talking about enrichment games. I would not be letting the dog crazying around the house. I would not be jumping on off the sofas, on and off the bed. I wouldn't be doing the staircase. I wouldn't be jumping out the car. And I would be really trying to get the owner to think about their exercise quotient with their dog differently. And that might mean you take some food out and you scatter feed. It might be you do some hide and seeks. It might be that you do some weave games. You might be going through the wood and stepping over different branches and just, not high impact crazy, but methodical, calm, collected, still doing a good quotient as long as he's not too sore. But look at the combination, guys. How exciting is that? Yeah. And Lynn, you're right. What about swimming? That's very, very interesting, but we haven't got a pool today. We're going to talk about hydrotherapy another time. But
yes. Or instead of swimming, underwater treadmill.
We've got some exciting times coming ahead because we've got somebody that's going to talk to us a lot about hydrotherapy, joining the team. Anyway, okay, so that's pretty good. I hope, guys, because time's limited, you've just seen that we've got the young dog, 8 months old. Wow, already all of those different avenues to treat. It's not just a case of he'll grow out of it, or it's not just a case of a non-steroidal and he'll get through it. We've just shown you already some very cost-effective interventions that are really going to change the course of this dog's life. Okay, just because time's limited. And I do see all your questions, and we're going to try and do them at the end, so please don't think we're ignoring you. Next one is a Rottweiler.
Bring it on.
It's a Rottweiler. Okay, and we actually did giggle about this. It's going to be a 6-year-old Rottweiler. We were thinking just talking about elbows, but the truth be known, it's not often you just get elbows in a Rottie. You're going to get more going on. So we decided to stick to the elbows on this one because our next case is going to be generalized. But Rottie, 6 years old, body condition score of 7 out of 9, walks like this. Really thick neck, really funny coat changes down his back, beginning to get a little bit funny about people touching him. Just a little bit. What are you thinking?
My worst enemy, obesity, is what I'm thinking, honestly.
Your worst enemy is what?
My worst enemy is obesity.
Oh, yes.
Yes. So that would be my first thing. But obviously, when the situation is what you just described, weight management, and not just management, but the actual losing of weight. And I think this is actually really important. My doctor told me, and I really, for whatever reason, well, no, whatever reason, obviously, it's because it's my weight that she was talking about. But she said, have you lost weight? And I said, no. She said, have you gained weight? And I said, no. And she was, great. You're managing your weight. And I was like, that's really cool. It's true. I'm managing it. It's just hovering there. But yes, in this Rotti's case, management isn't enough. We should be decreasing. And it's really challenging when the elbows are that bad and the poor thing is all front heavy and everything. Because like you said, probably, it has issues with that. So, but somehow we should be able to lose some weight. So again, here, it would definitely be a case of owner, working with the owner. How do we exercise the dog so that we get the weight down? And although we're not talking about hypertherapy today, but that would probably be one of my first things to do. I would do it in the form of underwater treadmill exercising. I would plan an exercise program to get the weight down from that dog. Yeah. On the other hand, trying to ensure the elbows are taking all that exercise, I would probably use hot pack, cold pack. Definitely that dog will need massage, poor thing on his back muscles and everything. Absolutely, the same advice like you said to the previous dog, that always applies. No asphalt, no hard surfaces, the no jumping, no all that. The no list, which is something. No list. Yeah. But you could use hot packs, cold packs, and maybe on this patient, I would also introduce the TENS, the electrotherapy, trying to manage the issues with the elbows, because I do assume they are painful to some extent. Yeah.
And that's where, like we were talking about earlier, because electrotherapies can be very time consuming. And this might be a segmental case because we've got bilateral. So instead of doing them individually and that being a 30-minute project, we could potentially look segmental just for time management. Or do you think that's me being wrong?
No, you can. I mean, again, it depends on the patient. Yeah. To whichever positioning of the, not flaps, on pads, they respond the best, then that's what we go with. And it is a case of finding the best solution for that patient. TENS is an electrotherapy method, but there are no rules to those either. There are no recipes. One has to understand the actual physics and physiology and everything involved to that treatment modality, and then how we set it all up that it works for this patient. I mean, the options setting the machine up are like 1,000 upon 1,000. So
yeah, seriously, this is I've got a lot of book learning coming my way. But so out of our three kind of interventions, you've already said again, this is really applicable to joint mobs. Maybe a little bit of heat therapy prior to a gentle grade 1, grade 2 joint mobilizations. We have got the massage for all the compensatory changes. And we've got the controlled exercise, avoiding the impact forces. We might add TENS in there as well. If you're going to do that, you've got to do it pretty frequently to make it count. Now, I'm going to step in as a vet again here because we need to make people realize there's a multidisciplinary team behind all. And again, if I find that these elbows are painful, then I am going to step in with a non-steroidal as my first line treatment. So if I feel that they're painful, if I feel that we have got what's called central sensitization, where the dog is irrationally painful. Do you remember I said the dog was beginning to go, rrr, rrr, don't touch me? I'm thinking that I'm probably going to add an adjunct to that. So that's another medication. So don't be surprised if I don't throw 2, potentially even 3 at you. It depends how bad the dog is. And then I'm going to be talking to you about weight control. So I'm going to be talking to you about your resting metabolic rate, your resting energy requirement, and how we can really lower, the amount of calories your dog's taking in so that we can hit that target weight. And for all of you guys go, well, what is a target weight? How do we get there and how quickly? You're looking at about 1% to 2% of their body weight loss per week is a pretty safe stage. So if you've got, say, a 35 kilo rottie and you're trying to shift a good 4 kilos off of it, you're looking at about 350 to 700 grams a week weight loss is what you're trying to push for, okay? So already, how exciting is this? Oh my God, we've just so many avenues of intervention for this dog. Talking about enrichment though, because this is so important, Kong work. I love seeing dogs that are beginning to use food toys and they have to place their foot and they've got to start mobilizing a bit themselves. They put their foot on the Kong and they're trying to get there. So they're exercising their neck, they're pushing through their shoulder, they're mobilizing, but they're doing it with what's comfortable to them. So that's another thing to think about, guys. Also doing the scatter feeding. If they're out in the garden and they're just little short movements, flexing through the shoulders, flexing through the elbows as they're sniffing out their treats. That's like a little mini yoga for dogs, a little bit of Pilates. So do you remember these sort of things can make a big difference, all right? Should we go on to 3 because we've still got questions? Okay, number 3. What breed? Labrador. 11 years old. So we're going to have the classic here, okay? So it's going to be the Labrador. I'm sorry, they are going to be carrying extra weight because that is just their life burden genetically. So a body condition score, again, 7 out of 9, 11 years old, and massive mane, like massive mane. We've really got bulky neck into shoulders. We've got this really fixed spines, just no movement there. Back legs really are beginning to wither away. So you can start to see the femur. We've got tremble, bit of a back leg tremble. Their placement's pretty poor in that they lose their balance. They're not very good at getting up. When you see them push themselves up and then they pull themselves forward to get to a stand. So we've got our classic picture of OA, and we've got arthritis confirmed in carpi, elbows, shoulders. We've got spondylosis down the back. We've got bilateral hips, bilateral knees. It's everywhere. What are you thinking?
It's not uncommon.
No.
Is what I'm thinking now. No, these are patients that we see. And this could very well be our first case 10 years later. But it's still living away, and it's still that's the end result, possibly, not necessarily, but possibly. But yes, there are things we can still do. And again, I think with this sort of a case, well, it's kind of wrong to say because I don't think I actually don't think.
Shall I be vet quickly? Shall I be vet while you get your thoughts together?
No, because this is what I'm trying to say. I think in this case, especially, the vet plays a really big role, and the medical treatment of the issue, yes, is like the key thing. Because it's really important to realize, as a physio, I have 10s, and it's just one of the electrotherapy modalities. I have lots and lots of modalities which aim to control pain primarily, but I cannot do it alone. I don't think with a patient like this, it's not even funny how seriously it should be taken that it needs to have medical treatment also. It's my opinion. I don't think any of my tools would be sufficient enough alone. And I think it needs very good planning of the medical treatment.
Yeah.
So you be the vet here.
I'm going to be the vet here. Okay. So I think when you've got so many locations, you really do have to accept that a blanket approach is okay. It's okay. And this dog is going to say, thank you for giving me some anti-inflammatory pain relief. And more than likely, we're going to be kicking in with another adjunct there. And there are an array of different medications. It's very dog dependent. It's also owner dependent. In this situation, I would really think about static hydro. So underwater treadmill, warm water, standing exercises as well, because I just don't feel that that is going to do much harm. It's going to have the heat therapy. It's going to be working the whole dog. It's going to take weight off those joints. And they're just going to sit there going, oh, wow, it's really nice. Thanks. And I know that when I've done the underwater treadmill, I've really loved being in there and just doing some gentle massage treatments, etc. So that might be a starting point with your physio coming in behind saying, right, now we're getting somewhere. We can be a bit more targeted. Is that true to say?
Yeah, and also from physiotherapy point of view, with a patient like this, it's you do generalize things, but you have to be very much on top of your game, as in, you know, if it has the shoulder, elbow, carpi, hip, stifle, tarsus, and spondylosis in between, they all won't be as bad all the time, you know. This week it's going to be the shoulders. They are really, really, really bad. Next week the spondylosis is just, you know, in flames, but the shoulders aren't that bad. So you need to kind of assess it and kind of take piece by piece as they come and just manage the whole of the dog. And again, the methods are various. I might use every one that we mentioned previously, or we might just end up going into, okay, actually it has OA, but it's starting to solidify, get it solidified. Yes, throughout, you know, there's not that much movement, but hey, you know, if this dog would be like 14 years old, you know, how much does she have to move actually? As long as she's pain-free and functional, I don't care if it's not full range of hip. If it can move that much, but it's not painful, it can still walk out, you know, pee poo, it's happy, it's okay. So this is a patient where we start doing, it's like, you know, those, if I can talk about humans a little bit, I think we've all seen those very, very, very old grannies in shops. In Asda is huge. They are always, you never want to go there because it's like it takes too long to get to the end of the corridor and back. But you've seen the old grannies who walk away with their rollators, you know, and they are like shaped like that. They're like in 90 degrees angle, and then their heads are like that because they want to see forward, and they look absolutely horrific. And you just want to go there and kind of go, turn the granny straight, like stand up straight, woman, and walk forward, sort of a thing. But just don't go there.
Yeah.
Leave the granny be. Don't touch the granny. Don't. Also, they can be very angry, actually. So just stay away from the granny. Because it looks like that. It's probably absolutely fine. The granny is in that position so that she can walk in Asda, you know, the whole bloody long, the whole very long corridor. Just leave her be in that position and she's fine. If you change that position, if you try to make her move with full range, she'll just collapse. She can't take it. So this dog is kind of the granny now. You know, it might not have the full range, but as long as it's as pain-free as we can make it, I'm happy with it. She's functional.
Yeah. And I think that's a really, really good point, because I must admit, at the beginning of my learning journey, there was a real tendency to try and do a lot. And you get presented a case and you want to attack everything at once and try and make everything better. And then you realize that that's like a pile of cans, and you just try and take everything you want, and it goes all falls apart, because they've learned to move like that. And you must only adjust a little thing at a time, otherwise you're going to make the whole thing collapse.
And you have to decide where is the limit for, you know, it won't be perfect anymore, but what is perfect for that dog with those limitations? You know, I'm back at my process, physiotherapy process. where do we set the aim? You know, what is our aim? We want it to be pain-free and functional. What's functional? Only says, I want it to go out for pee and poo, 5 minutes, I'm happy with it. That's it. I'm happy with it,
And I think that's where we've really touched a different discipline, which is palliative care. And I think it doesn't get the credit that it deserves, at actually how complicated it is. I think there's a lot of people out there go, oh, it's just palliative care now. No, it's just palliative care now. But I think Laura does it really well here. You feel like you're chasing the problem the whole time. You sort one, and you have to go over there and sort this out, and then next time you're doing sort this out, and then you have to sort out this. And palliative care is really, really hard work. Even though you're not trying to return them to full function, you're trying to say, I want you to be as comfortable as I possibly can make you, to make sure that you have a good quality of life. And I think this is quite useful for people to know. If I was in pain at the moment, and we classified my pain as 100%, so it's 100% pain I'm in at the moment. If somebody was to alleviate 10% here, 10% there, 20% over there, my pain state is better for me. I'm like, wow, do you know what? It was better than where I was. I feel better than I was. So this is a good thing. And I think we do forget that sometimes in our quest. And I say this from the heart because when Holly was at her worst, and oh my God, I was irrational. I was just a beast. And my mum took me aside one day and said, Hannah, it's okay to be in a bit of pain. You can't take everything away all the time. And she actually said to me, this is so bad. She went, Hannah, am I in pain? And I can remember going, so? Because I was so focused on my dog. And she was like, Hannah, I'm in pain. I have pain every day, but I still go to the greenhouse. I still do the gardening. I still, sit and watch TV. I still go out for dinner. She's like, you can be in a bit of pain. So I think it's really fair to mention that to people, because I know that I have helped a number of owners on this quest for pain-free when it's actually beyond the realms of possibility. What we pain reduction back into a happy quality of life. Is that fair? Do you think I've overstepped the mark?
Yeah, no. Yeah. And this is a really important thing to discuss and kind of go through, because also I'm sure you've had many lectures on it, but I still want to say that pain assessment in dogs and in different breeds of dogs and different individuals is really, really challenging. I mean, how, if we go into very deep parts of this, then how do you really know how much pain there was and how much you took away and how much, so yeah, but it's a really, really important discussion to have.
It is really hard. It's really difficult. So I think hopefully you guys, the intention of the 3 cases was to add context of where physiotherapy fits in, but we also wanted to demonstrate where the multidisciplinary team fits in, because there's a tendency for people to be them or us. And this is not a war. No. We're a team, and we're supposed to be working together and going, do you mind helping me out with this? And then I can achieve that. Another really key point that you said that I think is beautiful, we shouldn't be doing things and pushing them through pain. And if that means that you as a physio goes, I can't do what I need to do at the moment. Hey, Hannah, what can you do that is less involved, more pill-based, that we can get somewhere and then it can come back to me? Working together. So let's do questions. Can
I answer one that I saw?
Which one was it?
It was Ryan's question. When using TENS, would you leave this with the owners to carry out, and how often would you recommend they treat? Daily, 2 times daily, etc. Yes, there it is. Definitely, this is something I wanted to mention. At the clinics where I work, I actually have rental machines. I have like 30 machines currently, I think, at the hospital. And the way I do it is, if I assess that this dog might benefit from using TENS, I'll discuss it with the owner. If they are happy and willing to do it, I will always do the treatment the first time to make sure that the dog takes it well, I have the effect that I want, and at the same time, I'll teach the owner hand to hand how to do it. And if I'm happy with the dog's reaction, if I'm happy with the way owner is using the machine, and if the owner is happy to use it, I will rent out a machine for them, and the rent is like 30 euros for 3 weeks rental or something. So it really, it's just quite a small amount of money actually. And I will then give it to the owners. We usually recommend that they'll rent the machine at first to see if it actually works. If it works for that dog, they can then buy their own. The good machines are about 100 to 150 euros approximately, the really good ones already. Yeah. And if it works for that dog, it can be a really nice way of managing the dog's pain at home by yourself.
And I think
we are there. Yeah,
I'm really fascinated about supporting the owner as well. And I don't think as a vet in the first part of my career, I really understood the impact of having a dog with a illness until I went through it. And now I am just the advocate of the owner 100%. So being given a tool that you are using with your beloved, and you know that you're part of the plan, is so powerful. It's so powerful, because there is a times as an owner, especially in the later stages, where you just feel useless and you just don't feel that you've got your best mates back anymore. You know, you're floundering. You're running out of options. So actually being given a therapy that you can do on a regular basis while you spend time with your mate is fab in my mind. Okay, let's go to what's an easy exercise to build those bum muscles in an elderly Goldie? Is it stepping over things that are low enough for them?
Well, honest, but I know boring answer. Depends of your dog. It depends why the muscles are not there anymore and which muscles are the ones that are weak. So my best answer is that I really should assess your dog first and then tell you, is it stepping over something, going uphill or downhill, or, you know, different exercises affect different muscles. So for me to be a good physio, I would really have to be more specific and find out which muscles specifically. But it could be stepping over. Yeah, and exactly. Why? Yeah,
you know, and the amounts. Yeah, it could be like a degenerative myelopathy. It could be you know, a peripheral neuropathy. There could be something there that's really preventing. So actually having somebody assess and say, well, this is what I believe the underlying disease state that has left you here. This is your expectation. Because again, it's one of the things you hear of people that have learned how to do something on YouTube, and they're making their dog do an exercise with the best intention, but actually they're never going to achieve that goal. And the dog loyally, we're going, I'm really trying, but it just doesn't work like that anymore, and it hurts. So it's difficult to be able to advise remotely. Do you think?
Yeah, I think especially not seeing the dog and not, honestly, I would not even want to kind of throw any examples because it could be harmful, and yeah, that would obviously not be what I would.
Yeah, no, I agree. It's difficult. 7-year-old staph cross with spondylitis. How can I help? So I think it's spondylosis, and there is a difference here, guys. So spondylosis is more of the degenerative long-term. Spondylitis is more of an acute inflammatory thing. So we're going to say spondylosis.
Yeah, let's assume. So yeah, spondylosis. People, it's already past 10 in Finland, and I'm an old lady and I should be asleep. Spondylosis, yes. So we usually, I would use massage, just because they often react with their back spinal muscles. So massage is something, just if it has tension in its muscles, that would be something I would do. And yes, I would bring in TENS for this. It could be an option. If it hasn't been tried, I would definitely try it.
Yeah, and then also exercises, you know, so massage to mobilize, and then some exercises to kind of stretch and strengthen.
Yeah. And my best advice, obviously, consult your local veterinary physiotherapist and have them assess the dog and see whether or not, because they're obviously, you have to be aware, for example, TENS that we've been mentioning several times today, it actually has so-called contraindications, which means that when you absolutely never should use that treatment. Same applies to massage. So, you know, someone has to check that it's safe for that dog specifically. Before you do any of that. There might be options that you might ask about from your physio.
I'm sorry the computer keeps moving. It's Luna's dinner time and she's decided to disrupt the session. Like she keeps rubbing against the table as if say, can we go now? Right, let's crack on for a few more. Okay, now this is a tricky one. What is your opinion on the K-laser? Good in the hands of a vet nurse following training webinars or written material, or best saved for use by the physiotherapist?
Is that for you or me?
Well, I was going to throw it at you.
Oh, thanks.
That's
Well, my answer here is that I suppose this varies between countries, and it varies. It depends on the education and knowledge of the person who is using it, and that might be different in different countries.
It is tricky, and I think I'm not talking just about K-laser. I'm talking about all lasers.
Yes.
There's a big difference between somebody that's just like, whoa, lightsaber, yeah, down the whole dog,
Skywalker.
yeah. And there's actually somebody that's looking at the dog, listening to what the owner says, observing how the dog's moving, palpating it and going, I know that it has elbow OA, but that isn't what's the problem today. And this dog actually has got more compensatory pain. And I would be better concentrating my attention here at the soft tissue in the neck and like between the shoulder blades, rather than spending 20 minutes lasering the shit out of the elbows. And I just think that's true, isn't it, really? All of the modalities are always going to be better utilized in the hands of somebody that's got a good understanding of anatomy and physiology. Or am I being a cow?
No, I absolutely would say that, well, any modality should be only used by person who is actually educated to use that modality. I would never, ever, ever let anyone point a laser at my dog unless they were absolutely qualified to do so. And I would make pretty, I don't know, nice word for it. I would make damn sure that they are actually professionals in using those modalities. But it applies to laser, to TENS, to therapeutic exercises, to anything.
Yeah, I think that's fair. It is really difficult though, and just like looking at the real world rather than the world that we'd love to live in, that there isn't physiotherapists in every vet practice, and owners do go to the vet practice for their main advice. And you know, a lot of the people that are using these modalities are doing it with the best intention, and potentially they're getting some good results. But I just sometimes wonder, because I'm on my learning journey and I am absolutely gobsmacked at how little I know and how much I have to learn and how much better I will be the more that I know, that definitely the person using it, let's just hope that they have got an interest so that they're using it appropriately, shall we say. That's just me trying to be kind. You know, it is difficult. The person who's asking about herbal or natural, we've got a Facebook Live with the lovely Vila, who is coming back on November I think it's 16th. And we will be talking about herbal, but we do have a thing at CAM that if we feel that a dog is painful, then we're going to use the thing with the most evidence. And we do know that the pharmaceuticals will have more evidence. What Veal is really good at talking about is making sure that you use everything safely and in a combined approach. So she did a brilliant live about a year ago. You can find it on YouTube if you type in VEERLE into the Canine Arthritis Management YouTube channel. and she goes through so many different herbal interventions, but it is not an alternative to medication. It's a complement. We work together. It's not one thing or the other.
Same goes for the physio options, because we do have lots of options for pain management, but again, they are to be used under the veterinarian's referral in conjunction with the other treatment methods, so medical methods. But consult your local physiotherapist. Yeah.
Okay, so let's have a look here. What we'll do, just do these two, and I think we might have to leave the 10 top tips because we've been going for 75 minutes. Okay. My lab takes Metacam every day, which works well for him. Vet says I can give him 1 paracetamol as well, only when he has a bad flare-up. How many days can I do this before I seek further help? Okay, so as long as your vet has suggested this to you is okay, then you're kind of using it in an off-license way. So it is very case dependent. The product that is currently available, which has paracetamol in it, which is licensed, it's called Pardale, and it is paracetamol and codeine, and that's actually licensed for 3 times a day for 5 days. So that's where people quite often go 5 days, because that's the licensed product, and it's actually a very high dose. So it's 33 mg per kg rather than the 10 mg per kg, which is commonly quoted when people use it as an adjunct, like you're using in this situation. I don't tend to use it once a day. If I'm going to have a dog on paracetamol, I'm going to use it properly. So I'm going to have them on it 3 times a day, and I'm going to use it for a short, sharp burst and see what my result is. I don't feel that if you're having a bad flare, having paracetamol once a day is really going to be more than a tickle. I would be using it for the duration of the acute flare, knowing and intending to come off of it as I go back out of my acute flare into my baseline. If I've got a dog that's really becoming late stage and we're struggling with pain management, I might use it long term, but I will be checking blood parameters and I will be having a very good conversation with that owner and be working with them. So hopefully that helps you. Can I massage with spurs on the spine?
What is spurs on spine? Sorry.
I wonder if they're talking about spondylosis that's beginning to bridge or something like that. So
yes, this is actually Lynn. It's the same person of the spondylosis, isn't it?
Yeah.
Good. Yes, I would definitely go to see your local physiotherapist once so that they actually show you how to massage safely. Because with the spondylosis, it's really important to be gentle enough so that you don't actually by accident cause joint level movement on the spine, but your pressure only affects the soft tissue and the muscles. And that's actually a talent that you need to have someone to show you. But yes,
I'm coming over to Finland.
Spondylosis patient. Sorry?
I'm coming over to meet you. I'm going to come and spend a week with you.
Feel free, come. COVID is actually
I would learn so much. Okay, what's this one? I hope people understand it's not just point and press. Lots of training undertaken by responsible
laser. Yeah, definitely.
Yeah, perfect. And then there's this one down here, which we're going to have as the last one. Do you have experience with EMET therapy? I am a veterinarian and also an EMET therapist. I have great results with the kind of therapy. I don't know enough about this. I believe it's a manual therapy. I think I've looked it up in the past, but I don't know enough about it. So by all means, get in touch with us.
Yeah.
I believe it's in the collection of manual therapies. So
yes. I would love to hear some more.
Yeah, I wonder, I'm not sure, but I think it's a branch of Bowen. That it's a similar in a similar vein. But yeah, get in touch with us. info@caninearthritis.co.uk.
Yeah, I'll get it there too.
Yeah, I will pass it on to you.
Thank you.
It's always a pleasure. It's just like, seriously, I feel so happy talking to you because
same here.
Your energy is just so it's contagious. And
even if it was the physiotherapy process.
Process.
Yes.
But so this lovely lady, she teaches at Liverpool. So, if you want to look her up, She is very good at teaching. Thanks, Heli. Very grateful. So, all guys, thank you very much for watching. Please share this. Please talk to other people. Please open people's minds about what we can do for this disease. And I will be seeing you tomorrow because we have got Dr. Ernie Ward coming on for a short, sharp clip with the Big Barker Arthritis Awareness Week. And then we have got Kathy Murphy on Thursday. Then we've got Karen Perry Butler on Friday. And then next week, we've got Fergus Coots. So much going on. So much going on. So until then, thanks for watching and we'll see you next time.
Thank you. Bye. Go to physiotherapy.